Hi, my name is Nanci Peterson, BSN RN. I'm the branch director of a home health agency. We do skilled home health care. We're nurses and physical therapists, occupational therapists, and speech therapists who go into patients' home and teach them how to remain independent. The age of our patients is anywhere between 18 and the oldest patient I've seen was 103. We go into their homes and teach either the patient or the caregivers how to keep patients safe in their home. Sometimes that includes medication management, disease management, teaching people how to do their blood sugars, etc. We do a lot of wound care, ostomy care, IV antibiotics. We teach medication setup, disease process. Physical therapists go in, explain to patients how to remain independent, period. I've been doing this about 21 years. The reason that I love it is, have you ever heard that saying, Jerry Maguire movie, I am the king of the living room? Basically what it is I'm the queen of the living room. I am able to walk into a patient's home, assess the situation, find out what's safe and what's not safe for them, and encourage them to make changes to keep them independent without sounding forceful. I am able to be a guest in the home while I continue to take over the situation. The thing that I find most interesting about home health care that a lot of people don't know is when you work in a facility or a hospital, you don't realize what patients are going home to. For example, we have a patient who was seen in the inpatient rehab, walking with parallel bars, assistance, everything like that. When we got to the patient's home, they had a couch and a bed. So that patient needed continued physical therapy, assistance, DME to help them remain independent. The facility was not aware of what the patient had in their home because the patient said, yes, I have a fully furnished living room. Patient didn't have a fully furnished living room. Patient had a couch and a bed. Oftentimes we're able to assist patients with diet management. I've been to patients' homes where they have no food. Doctors can't understand why they can't get them better or get their blood sugars under control. It's because the patient doesn't have the money for food. My job is to assist them with that information, try to help them get resources, get the social worker out there to make sure that they can get done what they need to get done. Help them get resources, get the social worker out there to make sure that they can get done what they need to get done. Our average age, like I said, is between 18 and 103. I've seen 18-year-old gang bangers. I've seen 103-year-old independent people living at home. I specialize in wound care and ostomies. I do a lot of ostomy training in the home. First time I ever saw one was in a home. Never saw one in nursing school. Was able to tell the patient, show me what they taught you in the hospital, which gave me a moment to say, okay, I see what this is now, and work with that patient. I immediately went home, researched information, called some friends, got it taken care of. I am now not certified in ostomies, but I'm really good with them. IV antibiotics, most of the patients that we see already have a pick or a port, which makes life nice. We're able to teach them how to do their IV antibiotics and so on. Wound care, lots of diabetic ulcers, lots of pressure sores. Able to get those taken care of, work with wound centers, work with wound specialists, get that taken care of. My day is usually done seeing patients around 2:30, 3 o'clock. I'm able to go home, finish up paperwork, call doctors and so on, get that taken care of. It is a great specialty for anybody who wants a little flexibility and autonomy in what they do. You have to be brave enough to walk into the patient's homes. Although I always tell clinicians, if you don't feel safe, you walk away. Sometimes you get into the situation where you have to go, gotta run out to my car, and you never go back into the house. So it's a specialty where you can walk into $1 million homes or you can walk into a hoarder house. I have seen buried alive houses. It happens. But the best thing about my day is that I get to help treat my patients and get to help them stay independent and confident in their own homes. If you're not sure what you want to do, I welcome you to please message me, call me, whatever you'd like to do. I love home health care. I'm very passionate about it. I will answer any questions. I will help you with anything that you need to do. Please be safe, make good choices, and have a great